So hello from Sagara. I'm here today with Dr. Tom Christodoulides. Hope I pronounced that right. And
Good attempt.
good attempt. Who's got an unusual name like me? And we're here today. Tom is a consultant clinical psychologist for the CNTW Trust, and we're here today to talk about a speciality of his, which is sleep. So the interview should probably last about 10, 15, maybe 20 minutes, and we're just going to go through a few questions for him. So welcome, Tom. And
Hi.
Hi. So I've got a few questions for you. I just wondered maybe if you could just start by saying a little bit about yourself, and just a little bit about your life story, and maybe how you came to be a doctor of psychology.
Yes. Well, I've been living in the Northeast for the last 20 years. I moved up here from Kent to get an assistant psychologist job, and then trained to be a clinical psychologist from there. I trained at Newcastle University. Originally, I trained as a forensic psychologist, and then retrained as a clinical psychologist. And then since 2005, I've been working with psychosis in various different teams and services and various different configurations of the trust.
Great. So, and was there what drew you to psychology?
I was interested in it from in my teens. I became very interested in the social psychology experiments of the 1950s. There's fascinating studies by people like Ash and Milgram that showed how people's behavior could be influenced by wider groups, and that nudged me to study psychology A level. Right. And that interest then grew into doing the degree. I never really had any thoughts about career in psychology, but I suppose after a couple of years from the degree, I thought it was just a natural thing for me to progress into. So I got my first assistant job. I applied all over the country, and just happened to be first one I got happened to be in the Northeast, and then I've been here ever since. Sagara.
Great, lucky us.
No, lucky me. It's a lovely part of the world. So I'm very settled here and happy, and no intentions of moving back down south.
Okay, great. So, and I said that you had like a speciality of sleep. I mean, I don't know if that's true, but I know that I've heard about you and that you do stuff with sleep. So is that a particular interest of yours, or?
Yeah, I wouldn't describe myself as an expert or a sleep specialist, but it's definitely an interest of mine that's grown year on year. I guess one thing to say about sleep is that we know that it enormously impacts on mental health. And so how well you sleep impacts on how anxious you feel, or how depressed you feel, or your ability to cope with feeling anxious or feeling depressed. And vice versa is true as well. If you're anxious or you're depressed, it tends to knock off your sleep as well. So sleep has got an interesting relationship with mental health, and whatever area of mental health you work in, it's natural that you end up looking at or trying to help people with sleep. And that's particularly true for the area that I work in, which is psychosis. We know that sleep is a big risk factor for psychosis, and again, sleep is affected by psychosis. So it was very natural for me to be interested in sleep, because it's plays such a big role with psychosis. And I suppose my real interest grew. We had a trainee psychologist come on placement with me locally. So they come on placement with us for 6 months, but she had a PhD in CBT for insomnia. Right. So when you have someone with expertise like that, what you try and do is make the most of it and harness it and learn as much as you can. And so we managed to run a small pilot study of trying to really help people with their sleep. And she was able to access some really high quality training from Professor Jason Ellis, who works at Northumbria University. He's a real expert in sleep. Right. He came and trained us, and then we ran a small pilot study where we trained a number of clinicians and treated a number of service users with sleep problems, and it was very successful in a modest way. And since then, I suppose I've started to take a greater interest in sleep and try to grow our approach to sleep locally in the teams that I work into.
Brilliant, brilliant. And so in the current kind of situation with the coronavirus and everything, so have you noticed sleep being more of a problem for people, or?
Yes, absolutely. So all it takes is a quick search on Google, or if people are paying attention to the news, to see that actually sleep has been affected during the coronavirus for most of us, and that is very understandable. What we tend to notice with sleep is that it tends to get impacted under times of stress or trauma, some difficult life events. And I guess if we all look back and think about times in our lives where we've not slept well, for most of us, there's been a trigger to that. There's been something that's nudged our sleep off course. And I suppose the good news is, generally speaking, when that resolves, our sleep tends to return to normal. And so for most of us, our sleep has probably been disturbed somewhat during coronavirus for different reasons I'll talk about in a minute. But for most of us, that's very natural and it's very understandable. It's nothing to be concerned about, and it will return to normal without us doing anything in particular about it. I guess if you take a step back and think about why life events affect our sleep, there's different ways of understanding it. But if we think about it, one of the things that affects our sleep is how we're thinking and what's on our minds. And so for many of us, we'll have worries about the coronavirus and how it might affect us or our friends and family. And those things being on our mind might be enough to stop us getting to sleep at night, because we've got worries that are on our mind that are running through our mind. Or they might lead us to wake in the middle of the night with, for example, many of us have having coronavirus themed nightmares. Or it might lead us to wake early, as again we're sort of primed with stress, thinking about what's on our minds that prompts us to wake up earlier than we would normally wake. It's not only what's on our mind; it's also how we're thinking as well. So it's very easy to catastrophize and think the worst possible scenario at times like these. And of course, those thoughts can produce stress and anxiety, and that can prevent you from sleeping. And it's very easy to focus on just the worst aspects of the coronavirus, rather than noticing some of the gifts that we're getting along the way with it. So, of course, there's some traumatic aspects of the coronavirus, but also many of us have noticed some of the positive aspects about how we're changing our lives during the lockdown, and in some ways it's in positive ways. But also one of the things that stops us sleeping is rumination, which is going over the same things over and over and over again in a very sort of circular way, without an end point in sight. So much of what we're thinking about, but also how we're thinking, can knock off our sleep. And of course, much of our emotional state also impacts our sleep. So it won't be a great surprise to anyone that when we're at our happiest and calmest and most relaxed, most settled in ourselves, our sleep tends to follow to be smoothest and easiest to get to sleep and get a good night's sleep. But it's when we feel stressed or worried or very low or down or very angry, those emotional states tend to impact on our sleep. And of course, you can see how the coronavirus might nudge us into those kind of emotional states more than usual in our everyday lives. And then there's the other aspect of how we spend our time and our behaviour that can also affect our sleep during the coronavirus as well. So in lots of different ways. One of the ways is because we're spending more time indoors, and we're spending more time isolated from our friends and family. Um, we are often being blocked from undertaking the activities and hobbies that we would normally do to give us a sense of relief and pleasure and fun. And many of us are having to undertake new tasks at the moment and new roles that can feel overwhelming. So many of us are juggling competing work demands and childcare demands in a different environment. There's a lot of change occurring for us, and all of those things, all of those changes to our behaviour can impact on our sleep, because we know that access to sunlight or undertaking exercise and activities or social connection or feeling like your tasks and roles are manageable all lend themselves to better sleep. And a lot of those things have been nudged off for many of us. We were just talking about that before we started recording, Sagara, how it's impacted on us.
Yeah, no, it's really interesting, and you paint like a really big picture of it, of all the different kind of network of conditions that kind of impact on you. And I think you can think you're just this isolated, separate individual, but actually everything's affecting you, isn't it? And yeah, so it's really interesting to see that, and quite reassuring that you said that it will return to normal if you are suffering like lack of sleep. Then it will return to normal as well.
Yeah, absolutely. I think that's one of the key messages, is that it's very natural for your sleep to get knocked off at points in your life. And if all of us look back over our lives, we've all had bouts where sleep has been disturbed, and without doing anything, it naturally returns to normal. And it's a very natural response to stressful life events. Without having to do anything, it will resolve itself for many of us.
Yeah.
And I think the other thing to say is that I suppose I'm talking about general factors that impact on people's sleep, but everybody's different, of course. And so for each person, there'll be a particular set of circumstances or factors that are influencing their sleep.
Right.
And likewise, we all have a different predisposition to how well we sleep. So some of us are naturally good sleepers or heavy sleepers. Some of us are naturally more light sleepers and are more easily disturbed sleepers. We probably know that ourselves, or our friends and family know kind of what sort of sleeper we are. So we take that into times like these. So some people will be affected less and some people will be affected more. And I guess I've just outlined some of the factors that might influence how much each individual will be affected. But it's different for everybody.
Yeah, great. And so I know that you've created like a Word document which is a resource for people, but I mean, I wonder, we're going to put that on the Facebook page and on the Sunderland Recovery College website, but I wonder if you might just outline a few kind of top tips that you could give to people, so if they are suffering at the moment from that, maybe what they could do or how they could approach.
Absolutely. So again, as I mentioned earlier, everybody's different. So I can list some kind of common top tips to help with sleep, but I would say some of these things will apply to some people and some won't. And to take whatever's right for you. If there's one or two things that's helpful for you in here, that's great. And the rest of the stuff might not be relevant. These are kind of general top tips for everybody. I guess the first place to start is something called sleep hygiene. People probably have heard of that term, sleep hygiene, before. It just means sensible, healthy sleep habits that we should all adhere to generally. And that's the first place to start. It tends to be, nothing else tends to work if you don't have these things in place. So they're the kind of essential things you need to do to get good sleep any time. So one of the things to say is to try and reduce your use of technology as you approach bedtime, and in particular if you're in bed. So that means try to reduce or stop entirely looking at your phone or tablets or laptops or TVs before you go to bed, and having a cut-off time for that. A couple of reasons is, I think most of us know this inherently, but they're very stimulating activities, and those stimulating activities can make us stay awake for longer. And also most of those technologies emit something called blue light. It doesn't look blue, we can't see it as blue, but it interferes with our ability to sleep. That kind of light interferes with our ability to sleep. So if you can cut that down an hour before bed, or ideally stop it before bed, not use that technology in bed, that generally helps people sleep. The impact is so marked of using those technologies is that not only does it disturb that night's sleep, it also knocks off your next night's sleep. That's how powerful it is using those kind of technology. A few other helpful tips from sleep hygiene is that eating a healthy diet can help you sleep. So regular meals throughout the day, and generally speaking, not having too heavy a meal within a couple of hours of bedtime can help people sleep, as well as limiting alcohol use. So I think many of us understand that alcohol can make you sleepy, which it does. But unfortunately, alcohol has a rebound effect where it leads to more disturbed sleep, poorer quality of sleep, and early waking. So although it can help you fall asleep, it generally means you'll get poorer quality sleep and wake earlier. So it's not helpful. Also, I think, again, one of the sleep hygiene tips that most people know about is to limit your caffeine use. Caffeine stays in your system for longer than people realize. So I think if you can have a cutoff early afternoon for caffeine, that generally speaking is going to help you sleep. And the other thing to do is to try and make your environment as dark as possible where you sleep. So using things like blackout blinds, or if you haven't got those, having like a blackout eye mask to stop light interfering with your sleep. We know that the darker the environment, generally, the better quality of sleep and the longer that we stay asleep. So those are the first places to start. And generally speaking, most of us can think about one or two things that would help with sleep hygiene. But then there's some other things that you can do beyond that once you've got those things in place. One of the treatments for insomnia and helping people sleep is just exercising. On its own, if people do nothing else for sleep but start to exercise for 20 minutes a day, their sleep improves. So if it's 20 minutes a day, doesn't matter what time of the day it is, doesn't matter what type of exercise, as long as it's, again, not in that couple of hour window before bedtime, people's sleep will improve. And generally it shows that if it's 20 minutes and it's every day, doesn't matter what you do, your sleep will improve. So I guess even though we've been told we have to stay indoors, there's obviously exercise practice that people are doing indoors, like the PE with Joe Wicks. But of course, we can also go out to exercise during coronavirus too. So if you're able to fit that in, that's really helpful. The other tip is being outdoors every day can really positively impact on your sleep. So access to sunshine, doesn't matter if it's a cloudy or sunny day, can help you sleep. And generally the rule of thumb is about 45 minutes to an hour of direct sunlight every day helps you sleep later that night. The next thing to say is that routine and predictability is very important for sleep. So the stronger your sleep routine, the more likely you are to get a good night's sleep. So that means predictable getting out of bedtime every day, no matter how well you've slept, and a sleep routine for that hour before bed, where it's the same every night, tends to help people sleep better. What that does is, as you approach bedtime, and if you've got into a routine of it, it starts sending cues to your mind and to your body saying sleep's coming. And that shifts you into sleep mode and helps you fall off to sleep better. So I would say if you can have a predictable time that you get out of bed and time that you go to bed and turn the light off every day, you're more likely to sleep better. One of the things that most of us do when we're not sleeping well is we lie in bed more and try to sleep more, which is a very understandable reaction to not getting enough sleep. But actually, that's probably the worst thing that you can do if your sleeping has been disturbed. generally we give a 15-minute rule where you don't lie in bed awake for more than 15 minutes. If you've been awake for 15 minutes in bed, get out of your bed, go and do something else until you feel sleepy again. And by sleepy, I mean head nodding off sleepy like that. And then return to your bed until you fall asleep. And if you have one night's bad sleep like that, where you're up and down, generally speaking, the next night or the night after, you'll sleep better as you become more tired through a couple of nights bad sleep. But if you stay in bed whilst awake, you begin to associate your bed with being awake, and you associate your bed with being stressed, and you associate your bed with worrying about sleep. And next time you go back to your bed, those feelings will return, and that makes it harder to sleep. So you want to break that association by just having your bed asleep. And that's why we have that 15-minute rule. I suppose the other thing to mention, lastly, is that it's very natural, as we talked about, to be worrying at this time about things associated with the coronavirus. And there's a few tips that can help with that. So one is having a worry notebook by your bed, writing down everything that you've done that day, anything that's on your mind, or what you're doing, what you plan to do tomorrow. In a way, that's like downloading what's on your mind onto the page. And just the act of writing it down every day can be very cathartic and help people sleep. The other thing to say is that it might be helpful to have cut-off times for discussions or thinking about or finding information about coronavirus at this time as well. So you might say, come 9 o'clock, that's a cut-off time for coronavirus. You're not going to go on your phone and look on about it. You're not going to watch the news afterwards. You're not going to talk with your friends and family about the coronavirus at that point. So you give yourself a break from it before the next day when you can find out more information. Again, so you can build up a sleep routine. I'm trying to think if there's anything else I want to add.
I think I heard you. Did you give a talk at the Recovery College recently? Was it you that did that? But
on sleep, yes.
Yeah.
Were you there? Were you there?
Yeah, I was, and just clock that now. But like, I remember you said something about don't try to go to sleep, which makes me feel really bad, because I'm always telling my daughter at night, just go to sleep. Try and go.
Yes. Yeah, that's really, really good point. Actually, I'd forgotten about that. Yeah, it's something called paradoxical intention. We love our jargon, psychologists, but paradoxical intention means that for some things in life, the harder you try to do them, the worse they get. And it doesn't seem to make sense. It seems to be a paradox. And sleep is one of those things. So sleep is one of those things that the harder you try to do it, the worse you tend to sleep. And if you interview good sleepers versus bad sleepers, the bad sleepers are often really trying hard to get to sleep, and the good sleepers can't tell you anything about how they sleep because they pay it no attention whatsoever. And so they don't know how they sleep well. They don't give it any thought. And of course, it's that helps them sleep. And it's the trying and the effort to get to sleep for bad sleepers that stops them sleeping. And the reason is because if you're trying to get to sleep, that's a motivational state, that's a drive state. And you don't want to be in that mode when you're going to sleep. You want to be in relaxation, effortless, calm mode, not goal-oriented, trying to effortful mode. That's a very motivated state, which is energizing, which interferes with sleep. And of course, if you're not sleeping and you're trying to sleep, that's frustrating. And that emotional state of being frustrated or irritable or fed up or stressed in itself can interfere with sleep. So yes, one of the things we advise to do for people is if they find themselves like that and they are the sort of person that tries to get to sleep, we ask them to do the opposite, which is try to keep your eyes open for as long as you can when you're in bed and see what happens. Or try to stay awake for as long as you can with your eyes open and see what happens. And often what people find is when they shift into that state of trying to keep their eyes open, within a minute or two, their eyelids start to become heavier. what we say is try and fight that and try and stay awake as much as you can. And what sleep can very powerfully come over people when they take away all of that drive to get to sleep. So yes, like I said at the start, doesn't work for everybody, but that's a little trick to try if you're the sort of person that puts a lot of effort into trying to sleep.
Fantastic. And like what I love about what you're saying is that you're not saying go and grab some medicine, or you're not saying, and it doesn't cost any money. It's just like simple like things that you can do to kind of improve your sleep, basically.
Yeah, absolutely. So what I would say is, I suppose I've chucked a lot of information at you, but if you just picked one or two things that you might learn or do differently from what I've discussed, that would probably be a good place to start, I would say. And yes, medication, we know that there are medications that can help with sleep. And I wouldn't preclude doing that. Of course, you can speak to your GP or clinician about accessing medication for it. They tend to be short-term fixes, so they don't tend to prescribe them for longer than a couple of weeks generally. And I suppose what I'm talking about is trying to have a better relationship with sleep, or having a better relationship with your bed. And the things that I'm talking about are how you might go about that. Many of the people that I see, they've got into an unhealthy relationship with their bed and with sleep, where they start to dread going to bed at night because they know this is the place where they lie awake and worry and get stressed. And so they've already, as they walk into their bedroom, feel a sense of dread. And I guess what I try to do through things that we've discussed today is to help them find a new relationship with their bed and with sleep, where they actually start to look forward to going to bed again, and they start to crave going to bed again because they know this is the place where they sleep, because they've retrained their brain and their bodies that actually this is where we go and where we do that. And that is the reason why we talk about having cut-offs and why you don't stay in bed when you're awake, because all of that is retraining your brain to associate bed with sleep, and just with sleep, rather than all these other activities that we've started to do by bringing our mobile phones into the bedroom.
Yeah, brilliant. That's wonderful. Thank you very much. I've got one more question for you, which I can't resist asking, which is, how do you sleep?
Well, one of the things that I talked about at the start was having everyone's different and things that affect their sleep differently. I've got a 2-year-old at home, and he is dramatically impacted on my sleep. One of the things that Professor Kirsty Anderson talks about, she runs the sleep clinic at the Freeman Hospital, which is like the regional sleep service for our locality. She talks about how things can affect our sleep, and often parenting is one of those things when you have a young child, because of course they're awake often during the night, and it interferes with your sleep. But one of the things that she's noticed is that when their sleep returns to normal, parents are left with bad sleep. And so that's when often people seek help, is actually my child's sleeping through, but now I can't sleep through, because again, their associations have all gone to whack from parenting. So generally I sleep pretty good actually, but it has been a tricky ride for the last couple of years. So I try and practice what I preach, but I think I'm just as guilty of all the things that everyone else has talked about, like going on your phone in your bed, etc., etc. I think I understand all of that. I think we're all guilty of it. So, and I definitely know that when I stick to my sleep routine better and stick to my good sleep habits, I sleep better, of course. But yeah, I'm not always a good boy, Sagara.
Okay. Well, thanks so much for coming today and doing this with me. And I'm sure it'll be loads of use to loads of people. So I'll put it on the page soon. And yeah, just thank you.
It's my pleasure, Sagara. And sleep well, everyone, and happy dreams.
Thanks, Tom. Thanks.
Cheers.